Now tell me about the health record exchange program that GP Partners is running, has been developing. You've received quite a bit of attention. Various consulting firms and others have recognised it for its quality. Tell us what it is, what it delivers, and why you think it's an important model for Australia.
Sure. Again, fundamentally, it's the first thing we do is we try and really target the high users of the health system. For instance, our private insurers say that 1% of the population accounts for about 45% of their cost base, and the statistics that I've seen in other areas seems to be in that sort of weight. So, if I look at the figures, it means that we don't need to do a business case around putting shared records to support the community. We're not trying to do 20 million Australians. We're actually trying to do 1% of those who account for 45% of our cost base. So that's a little around the business.
And that's
case.
in your region too, isn't it? In Brisbane?
In every region.
Right, okay.
Okay, that's national
just broadly
figures.
speaking, but
that's
for
what
you,
I'm saying.
yes.
So that means that, I mean, we cover a population of about 650,000 people. So that means today we have 1% of those who are walking around accounting for a large proportion of our health dollar. But these same patients are, our GPs refer to them as the heart sink patients. They come in and their heart sinks because, they booked their 15-minute appointment and I've got so many conditions. They just don't know what to do. It's going to take an enormous amount of time and effort to sort out their challenges.
So they get 30 minutes.
Well, it's not just that, because they have a whole lot of other health service providers. These are the same patients which are actually using a lot of services in nursing, community nursing services. They are also the frequent flyers or the major users of the hospital component. So we're actually talking about the same people.
Yeah.
So it's not just giving more time. What happens today, or what happens prior to having shared records, is the system is based on a paper-based point-to-point mechanism. So in other words, if a patient goes to a specialist and that specialist puts that patient in hospital, then that discharge is likely to go back to that specialist. It doesn't, or if it was the GP who admitted that person, it doesn't go to the other allied health services.